Hey friends, welcome back. So today we're going to talk about this. Now, this is really controversial. I'm not trying to be cryptic, but I'm not going to say this word in this video because honestly, this platform actually has been able to figure out when I talk about the virus and even mention this, it affects my channel. So I've gotten a lot of requests for this video. I'm going to strip out all the emotion and all the biases. I'm not going to tell you you should go out and get this. I'm not going to say you shouldn't. This is a very personal decision based upon your age, whether or not you have natural immunity. For me, I'm a 38-year-old male. I have natural immunity. I've been exposed to this. I have antibodies. Should I go out and get this? Probably not. Why would I waste this when there's an overweight 60-year-old male that has high blood pressure and a belly out to here that really probably needs this? Because all the different types of medications like these that we're going to talk about today, we're going to talk about the different forms that are now commercially available under the emergency use authorization. We're going to talk about the mechanisms. Now, I'm biased. I'll tell you which one that if I were if these become mandatory, hands down, I'm going with the Pfizer mRNA, and I'll share with you why. And why and the Novavax, if it becomes available, why I would choose that over the adenovirus vectors, okay? So again, I want to strip the emotion out of it because this is a very controversial, polarizing issue. I think what you're seeing from the pundits that are being interviewed on television is we need to give these to every single person to just wipe this thing out. But what you're not really hearing about is these are becoming less and less effective against different variants that are emerging, like the B.1.1.7, the B.1.35 variant, right? So efficacy goes from in kind of Gen 1 virus, 90-95%, it's going down to say 60% with these different variants, okay? So I have natural immunity. If you don't have natural immunity, and if you're at high risk or you're worried about your parents or your grandparents, I've had this question a lot too. Hey, my dad's 77, doesn't exercise. Which one of these should I get? Now, I'm going to go with Pfizer microRNA, and I'll share with you why. Because, well, I think it's just hold that thought because there's a little bit of I don't want to say a red flag, but something to consider with the Pfizer and the Moderna with regards to the delivery system, the polyethylene glycol, and that has its own set of challenges and issues. So just hold that thought for a moment. But here's what I'm not a huge fan of this particular delivery system, which is this right here, option number 2, which is, and then let me just pause. So if we talk about the SARS-CoV-2 virus, it has these protruding proteins called the spike protein. Now, there's different variants that are just changing small amino acid sequence that are causing these spike proteins to open up more, and therefore they have more affinity for the endogenous receptors in your body called the ACE2 receptor. Now, those receptors are found in the adipocytes and the fat tissue, so it may be that the viral load in overweight, obese people is higher because they have more receptors for the spike protein to get onto and so forth. They might have higher viral loads, therefore higher disease severity. But these variants are changing just one amino acid or a couple of different amino acid structures in this spike protein. And so therefore, they might render these things less effective. So just keep that in mind. Now, when you naturally get exposed like I have, or many of you have, now we have tens of millions of people in the United States alone who have been infected, okay? What happens first, actually you get immunity, adaptive immunity to the nucleocapsid, which is another protein. There's the envelope protein that the natural immune system makes immunological memories to. There's the envelope, the M protein, the N protein or the nucleocapsid, and the spike protein. So the shortcomings of all of the commercially available these so far is they only work on the spike protein, whereas this is why I think health is wealth, because if you naturally get exposed, your immune system is making immunological memory to the nucleocapsid, to non-structural proteins. There's that, I think, NP15 and NP17, and these are homologous between other more benign coronaviruses. So there's something really cool about your body's natural immune response. And again, I'm sure I'm going to get flagged for even saying that. But again, that's the shortcomings of these that are available, is they're just working on the spike protein, but your natural immune system, if you do get exposed to the virus, you have the nucleocapsid, you have the envelope, you have the M protein, which are making adaptive immunologic memories if you have a natural infection, okay? So let's talk about the mechanisms here of the different compounds that are available and which ones, personally, again, this is not medical advice. Please work with your doctor, your family physician. I'm not here to give you medical advice. I'm just sharing with you how these things work and which ones personally I would take when given the option, okay? If they become mandatory and so forth for me. So okay, so we talked about the spike protein. This is how these are all the targets, are just different delivery systems. So the Nova vaccine is based upon this protein subunit technology. So it's basically how vaccines usually work traditionally is they have some sort of adjuvant or an immune adjutant. And so the Novavax is using a saponin from a tree. So this is like a phytochemical, if you will, from some sort of tree. And then it has a recombinant spike protein in there. So it agitates your immune system so that your body's antigen presenting cells, they'll become agitated, they'll see this protein, and they're gonna put it on a platter for the rest of your immune cells to be like, okay, T helper type 1, CD8, CD4 T helper cells, here's this antigen. When you see this again, attack it, right? So that's basically this Novavax technology. I think as of the recording of this video on the 11th of April, it's in phase 2 trials. I would be very confident in recommending this because, I don't like this adenovirus technology, which we're going to talk about next. So minimal downside side effects. It's not a transgenic therapy. You're just irritating your immune system, transiently exposing this spike protein to it. And it seems pretty cool, pretty safe. There's not a lot of yucky stuff in there, okay? That's Novavax. Okay, if you get that option, I think that's probably sufficient, especially if you have allergies or asthma or an autoimmune disease, which is maybe why some people that take, say, Moderna or Pfizer get challenges, okay? So that's Novavax. Let's talk about what I'm not excited about. And this is this recombinant transgene therapy using a replication deficient adenovirus vector. So this is what AstraZeneca or the Oxford folks are doing. The Genison, which is being distributed by Johnson & Johnson, which I think was just pulled. I just got a tweet about that. So basically what they're doing is they're taking this replication defective adenovirus, which is able to get into the nucleus of your cell, and inside the adenovirus will then it will inject into your own genome the spike protein plasmid, which contains different variants so that your own genes make a spike protein, and therefore your immune system will see that and say, hey, whoa, that spike protein is not from us. Like, how did that get here? B cells make antibodies against it. Your CD4 and CD8 T helper cells are going to make immunological memories against that spike protein. So then when you get exposed to SARS-CoV-2 in the future, you have some adaptive immunity for that on both the cellular and antibody side. Now, why don't I like this technology, and why would I not necessarily recommend this? Is because it's a transgene therapy. There's just a lot of unknowns here. You're getting a defective virus that's not going to replicate, but it's inserting DNA into your nucleus. That to me is like a little bit. Now again, this is all occurring fairly locally in the skeletal muscle, the deltoid. You have a lot of lymph here around the armpit and lymphoid nodules. So it's going to be getting injected into the muscle tissue, and hopefully then your muscle tissue the DNA, you'll undergo, transcription, translation, make the spike protein. Then all the immune cells around here are going to make antibodies and against that. Okay. Now, if you've already had this, like my neighbor, I think he's 39. He lifts weights, eats pretty good, super active lifestyle. He had this. He had a record on his deadlift that day. So for healthy people, all of these things, if you get it and you're super healthy, you're probably not going to have challenges, right? So that's the thing. Like, I'm not saying go out and get it tomorrow. It's a personal thing, right? But the healthier you are going into this, whether you get exposed to the actual virus or you get exposed to these, your chances of side effects are pretty low. So just keep that in mind. Okay. So again, not a huge fan of this for that reason. Maybe a representative from one of those companies can reach out to me to tell me what I'm missing out on. Now, again, if Novavax becomes available, I'd probably lean for that. What's available right now is you have Moderna and you have Pfizer. And what they're doing is they're taking the microRNA, which I'll define in a moment, and they're putting that in a liposome that's called PEG, polyethylene glycol. Okay, so this has been utilized in supplements and drugs for a long time. This is basically like a nanoparticle technology. So it's able to cross into your cells, directly into your cells. So again, it's being injected into your muscle tissue, being absorbed. And then within that sort of nanoparticle is this microRNA. Now, you've probably heard, of course, you've heard of DNA, where you're like, well, I've heard of RNA. What's microRNA? So you have, transcription and translation. So you have your genes. Your genes kind of make a copy in the form of the language of RNA, and that gets translated into protein. So you're getting the in-between protein and genes. That's what basically RNA is. MicroRNA are just small splices of RNA. So basically, your protein synthesizing machinery, the ribosomes, inside your cells will see this microRNA and they'll be like, oh, microRNA, okay, we're going to make whatever protein is encoding for this microRNA, and that's the spike protein. So it's not a transgenic therapy like this adenovirus vector technology. And so your cells are making this spike protein. And again, it's just like when we talked about the Novavax, where your antigen presenting cells are sending the message to your immune system that you have the spike protein on board. Your own cells are making the spike protein, but your immune system is like, yo, that's not supposed to be here. Okay, CD4 and CD8 cells make some memories against this. B cells see the spike protein, ramp up antibody production. So that's what's going on. And again, the shortcomings of this is when you naturally get an infection, you're making immunologic memories to the nucleocapsid, to the membrane, to the envelope, to the non-structural proteins of the virus, like your immune system, but it's making memories to specific amino acid sequences. So as these variants keep emerging, right, because we're putting selective pressure on this virus, because a lot of people are getting vaccinated, there's going to be new lineages. And these new lineages might outsmart, some of the, they might make the spike protein have, because the virus is constantly replicating. And when you're replicating like crazy, there's natural mutations that occur. And some of those mutations are advantageous and selected for, and others aren't. So that's just kind of what happens, this selective pressure. Now, because a lot of people are maybe in the asymptomatic phase of their exposure, and then they might get it, the vaccine, we're putting pressure on this virus by doing widespread vaccination. So I think the thinking from the health experts are like, hey, look, if we get everyone vaccinated as quickly as possible, then we're just going to smother this fire. But going against that, the counter argument to that is we are creating more selective pressure for this particular fast replicating bug to, if it gets a mutation that's advantageous and can outsmart the spike protein, it's going to transmit more. So just understand that, like, this is not 100%. Like, so if you're super high risk, for example, you're a smoker, you're overweight, you're hypertensive, and you think because you got one of these, you're totally safe, but there's other variants and things like that circulating, just understand this is not 100% guarantee. So again, we still need to focus on healthy lifestyle change. We still need to focus on breathing through our nose and making sure we're having adequate oxygenation, and we're not sitting there mouth breathing and having sleep apnea and sleep disorder breathing. We need to exercise. We need to eat healthy, real foods. And by the way, scientists have shown in various other studies of these that your health makes these more effective. So in the several weeks leading up to getting one of these, and in the 2-week window after these, you really need to probably don't drink a lot of alcohol, go to bed at a reasonable time, manage your stress, eat real food, don't go out and get a bunch of donuts, exercise, like do all these things, because if you're gonna get injected with one of these things, you want it to work, like straight up, you want this thing to work. And so in order to your immune system has to do the job. It has to make antibodies. Your T helper cells have to make immunologic memory. So don't burden them with gluten and wheat and excessive alcohol and poor stress management and inactivity. Like, do the work that you need to do. So the only downside, I think, to this particular technology is the fact that some people are responding immunologically to the polyethylene glycol. And so if you're already prone to allergies, autoimmunity, you have psoriasis, rosacea, you have asthma, eczema, you might get more, more antibodies to things. You can get cross-reactive molecular mimicry. So if you make an antibody towards something, and this particular something, the polyethylene glycol, maybe it's structurally similar to some sort of lipid in your body, there's challenges with that. And so there is immunogenicity associated with the polyethylene glycol. So that to me is the only downside there with that. Now, why Pfizer over Moderna? Obviously, the more environmentally friendly version is Moderna because that does not require such extensive, freezing to make sure that this microRNA is not damaged. But Moderna, this is their first go around. They're a new company. Hats off to them, and everything, for developing this technology and things like that in a short period of time. The downside of that is they're using a contract manufacturer to make this, which has had challenges in the past with regards to quality control. So Pfizer is using domestic, meaning manufacturers here in the United States. They have been doing injectables for a long time. So I just think from a quality standpoint, probably a little bit better. But that's just my personal opinion. Manufacturing is tough, and manufacturing injectables is probably even tougher. So I would trust someone who's been doing that for a while. So friends, hopefully this didn't piss off too many people. Please don't flag this video. I think hopefully the value here will be able to help people better understand, which one they should or shouldn't take and so forth. Again, there's a lot of doctors that are saying look, if you have antibodies and you've been exposed to SARS-CoV-2, does it make sense for you to go out and get one of these right now, especially when these are in short supply? And there's a lot of people that are overweight, that are pre-diabetic hypertension, that haven't yet had these, that could be better served than someone like myself who's metabolically fit, have a low C-reactive protein, not hypertensive. Why would I waste this on me or my wife, when we've both been exposed and both have antibodies, when there's a short supply going around? So friends, I know I'm going to get hate for this video, but I'm just grateful that you tuned all the way in. If you found this helpful, please hit that like button. You can share this with a friend or family member. And, if you want more on this topic, let me know. I mean, I do quite like, and I have a degree in biology. I like, diving into the mechanisms here, but just wanted to make this for you because a lot of you have asked for this. So, yeah, thanks for tuning in. We'll catch you in a future video down the road. Bye now.